So how you guys doing tonight?
Good.
I'd like to first start out by asking you guys a couple questions. Could you imagine a world where antibiotics would not work? A world where we could not cure ourselves from diseases? Well, Miriam Falco actually reported that the CDC Director Thomas Frieden mentioned a post-antibiotic era, a time where current antibiotics would not work and new ones were not yet approved. Now, this is a serious problem for us. The CDC actually says that this is the most critical public health threat there is today. It simply affects everyone. We all get sick, and we all take medicine. Now, this is also an economic burden because this increases healthcare costs, and antibiotic-resistant treatment actually takes longer, which this could lead to lost wages as well. Now, the Mayo Clinic does admit that antibiotics save lives, and this is a very true fact. Now, antibiotics are effective only against bacterial infections, some fungal infections, and some parasites. They do not work against viruses. Bacteria also swap genes very rapidly, which this is how they increase their antibiotic resistance. Now, Brenda Goodman also reports that there is good bacteria that live in our gut. Antibiotics also affect these good bacteria, and they do wipe them out. The good bacteria produce vitamins for us, and they increase our immunity. By killing off these good bacteria, this could lead to asthma, obesity, and or cancer. Antibiotics do harm babies as well because they are in the middle of developing their good bacteria. Some species within us are actually going extinct because of our overuse of antibiotics, and this could lead to a new world of problems that we have not yet encountered. Now, we need to know when to use antibiotics. Again, they should be used only against bacterial infections, some fungal, and some parasite infections, but never against viral infections. As you can see, the flu, along with most coughs, sore throats, and ear infections are viral infections, which antibiotics have no effect against. Now, the CDC recommends that we should get plenty of rest and fluids and also try some over-the-counter products before seeking treatment. We need to know when, again, not to use antibiotics. Catherine Gritter also reports that we should not take antibiotics for the common cold, and there's a very simple reason for this, because it's not a bacterial infection. And the Mayo Clinic says that we should never take antibiotics without a prescription. They also say that we should never save antibiotics from previous prescriptions just in case we get sick along the way. We should always take antibiotics for their full course, whether we're feeling better or not. Not taking antibiotics for the full course actually leads to antibiotic resistance. So what would happen if we continue to use antibiotics the way we do today? Humans use about 7 million pounds, and animals use about 23 million pounds of antibiotics. That's a whole lot. This leads to the main cause, antibiotic resistance. Miriam Falco actually reported on a couple of superbugs that are out there today. For instance, CRE infects about 2 million people, and 23,000 of those people end up dying because there's simply nothing left to treat them. The Mayo Clinic reports about drug-resistant tuberculosis, which the course of treatment can take about 2 years, and that does have severe side effects. Now, we need to know about other treatments, of course. The Mayo Clinic says that we should seek natural, non-prescription treatment before seeking a doctor. Something as simple as water, lemon, and honey for a sore throat, or some saline spray for nasal congestion can really help. And again, the CDC recommends plenty of rest and fluids. Now, when do we seek a doctor? We should seek a doctor first for education. The CDC and Mayo Clinic staff report that we should never demand antibiotics from a doctor, nor should we accept them without asking why or asking for any alternative treatments. Brenda Goodman also reported a study that showed that doctors actually keep patients on antibiotics even after test results show that they have a viral infection. And most importantly, we need to stay informed. Miriam Falco says that we should ask doctors that enter our rooms if they have washed their hands before. Can never be too safe. We should get familiar with the differences between viral infections and bacterial infections. Again, most colds and sore throats are not bacterial infections. And the CDC is now using a new method of describing drug resistance bacteria. We should definitely pay attention for this. They're using certain terms such as urgent, serious, and concerning. Right. So let me ask this again. What would it be like to live in a world where antibiotics would not work? As you can see, there's plenty of ways that we can prevent this from happening simply by using natural methods or over-the-counter products. We should definitely take the advice that the CDC, the Mayo Clinic staff, and some of the other reporters give us because it can greatly, greatly affect our future. Thank you guys, and I hope you guys help stop using antibiotics as much as we are today.